am Ms. J.
I'm Destiny Faith.
And I'm Laura Brody.
And we
Nice
are the
meeting you
news
guys.
home of urban pop news, interviews, and juicy tea about your favorite celebrities. So let's get into it. We are being joined by you right now. So can you tell our viewers who you are?
Yes, I'm Dr. Voskin, and they call me Dr. V from Ghost Plastic Surgery. And it's one of the biggest plastic surgery clinic on the Eastern Seaboard. And that's what we do.
All right, well, we have some questions for you. So first, my first question to you is, what made you want to become a plastic surgeon?
Well, I never been a plastic surgeon. I never lied about it. I was a long time ago a pediatrician and emergency room physician. Then I was doing a lot of cosmetic dermatology, lots of injectables, until I slowly moved into the field of liposuction, not even plastic surgery, just a liposuction. And been doing it for the past 15 years, liposuction and body contouring. I don't do myself plastic surgery procedures except the liposuction and BBL. But we have a tons of plastic surgeons, board certified plastic surgeons who does this procedure at our centers.
Awesome.
So it's different than, so plastic surgery is different from lipo, like the lipo, am I understanding correctly? Like is
No.
it different?
No, there's a whole concept of not really, let's say, what put plastic surgery as a cosmetic surgery, because I emphasize cosmetic because of improvement. We're looking for a cosmetic improvement. So plastic surgery is kind of a little bit off there because plastic surgery is a specialty. Plastic surgery is not a cosmetic surgery. It can be different plastic surgery procedures, non-related to cosmetics. So plastic surgery, as well as non-plastic surgeons, doing a lot of cosmetic surgeries nowadays. And cosmetics means for a body image or facial improvements. That's what cosmetic world is. Surgical part is just a part of the overall cosmetic medicine. So in this case, we call them plastic surgery or cosmetic surgery procedures, which is, let's say, liposuction and body contouring. It's a clearly cosmetic procedure. We all know that. So, and it is procedure. It's not really a full surgery because it's a surgical procedure, but that's not full surgery. Since we're not opening the body apart, we're not doing all these things, and you don't need, you don't enter the world of real surgical procedure. So liposuction is a little bit different.
Got it.
So what changes have you seen over the past 15 years since you've been in this industry with, the surgeries and the liposuction? Like what changes have you seen?
I would say the whole cosmetic industry was going by 7 miles a year ahead. Doesn't matter which part of it, and certainly plastic surgery part, of course, as a part of it. And the trend right now is a look. The world become much more visual. The visual effects, Instagrams, selfies, people becoming, I think, more aware of what they look and how they look. And hence the demands becoming increasing in the cosmetic surgery world for more perfection, for better silhouettes, for better facial looks, appearances. Look is everything at this to nowadays. So I think it will be increasing more year after year. And the number of procedures that we use and techniques that we utilize are also changing and ever increasing right now. So I think the future of cosmetics, I don't know about liposuction, it's the hottest procedure probably on the market, and the most discussable procedure on any ends of the world. But I think lipo will be a mainstay. I think more breast procedures might be evolved. That I think will be in near future. What's going to be in 5-6 years, I don't know. But I think for the next several years, this is definitely a trend.
Well, we see a lot of people, I'm sure you see a lot of people bring Kim Kardashian's picture, Nicki Minaj's picture and say, I want my body to look like this. But as an understatement, is there some time where you're like, hey, maybe this isn't the route you need to go. Maybe we need to have a different route. So do you ever suggest that to any of your patients, or are they always strictly like?
Yeah, I think every normal cosmetic doctor would advise the patient and do examination, obviously, on the patient and explain. that everything really belongs not to Kardashian or Angelina Jolie or anybody else. It's their bodies. We're talking about each individual patient separately. All of you sitting in the room, completely three body types, different, obviously. So the procedure is supposed to be designed to that baseline, to that body, and see what can be improved from what the baseline you have. In, let's say, flex scalp world that we created, the BMI is a crucial point, because let's say BMI of 35 and procedure result cannot be the same as BMI of 25. You have to understand those things, and that's what we're trying to. People come with the pictures, obviously, with Kardashian's pictures, with pictures they get from the internet, and I say, I want this body. It's our job is to explain, yes, I want you to go the same direction. And we're going to do anything possible in kind of achieving somewhere close to that result. However, you have to understand that everybody's shape, consistency, quality of skin, age, everything, there's so many variables that falls into that category. And our job is to explain to people what in realistically, which is very hard to deal with the females on that, the word realistically, to explain what you can get at the end. You know, that I think that's the biggest challenge in the cosmetic world, because everybody is looking at certain pictures. They come with a picture and they want the same, but it cannot be the same. It can be worked in that direction, and the end point might be obviously different.
So if someone is interested in multiple procedures, say for instance, they want to get a mommy makeover, they want to get a BBL, they just want to get their body all the way back right after having multiple children. Do you usually suggest that they break it up into multiple surgeries, or can you perform that surgery all at one time?
We don't suggest to do big procedures at once. And that's a big problem in many clinics, and resulted many times in bad consequences and death even, because you have to understand the body going for a surgical procedure or a surgery, it's certain stress involved for the body, maybe not for you, but for the body. So body have to be prepared for recuperation later on. And the amount of stress that you provide during one single procedure might be overwhelming. And your mechanisms of repair and development and recuperation might be failing. That's why the procedures have to be, let's say, we don't book any surgeries that longer than 3 hours, period. Okay, because we know that the body easily can take 3-hour, 4-hour procedure with absolutely no problem. But once the procedure starts becoming, and also you have to take into consideration how much tissue damage you actually do during procedure. Let's say mommy makeover. You have, of course, every female wants to do everything at once. Obviously, it's very convenient. However, if you have to do the breast, and you have to do tummy tuck, and you have to do body flex scalp liposuction or legs, everything you put in one session, you have to understand the physician can do it only during a certain amount of time. It's going to be maybe 8-hour, 9-hour procedure to do all of that. And considering if especially part of it under general anesthesia goes, so now you're adding another stress of general anesthesia and drugs on the central nervous system. So long procedures we do not recommend, we do not perform them. We rather do it on the 2 different occasions, and it's much easier healing, much easier recuperation, and the only thing is maybe not convenient, yes. But everything else is for the patient.
So I have a question, because I've seen like some videos, like some women are up while you're performing on them. I truly just want to know, like, what is it that you give them beforehand? Like, do you give them something to numb them? Do they take something? How is that process before you're about to do the procedure?
Oh, we do most of our flex scalp procedures under tumescent liposuction, meaning under tumescent anesthesia, should I say, because once we give anesthesia, it's a local anesthesia. Local meaning it's going to be administered to the area we're going to just about to start working. Okay. There are a lot of controversy on the internet because people don't understand what it is. There are a lot of haters around. There are a lot of people. But let me tell you, we perform about 600-700 procedures a month across the centers. 95% of them under tumescent local anesthesia. All right. That wouldn't be possible if that would be really problematic, And we do that for, I would say, in in such amounts in about 6-7 years already. So tumescent anesthesia is very easy, and you don't have to knock out the brain. Okay, there are a lot of procedures, and it's actually a growing trend too in anesthesia world. There are a lot of procedures that can be easily performed under local anesthesia, so you don't have to put patient technically body dead, right? That's what the general anesthesia is. When it's required, it's absolutely required. You cannot do cardiac surgery without general anesthesia. But with a local, we just infuse a lot of tumescent, specially prepared liquid with a lot of lidocaine in it. In that area, we usually give a patient about 10, 15, 20 minutes, maybe a rest. Like I usually say, we're marinating it. You know, that area have to become soaked and pain-free. And after that, when we start the procedure, you're going to have some vibration sensation, mostly weird sensation. 95-98% is pain-free. Certain areas might be here and there just a little bit sensitive, but again, we don't torture patient. We just add anesthesia a little bit, and this is it. This is done. Okay, there is no continuous pain. There is no torture. There is no nothing like that. Mostly people will feel just a vibration, and the procedure of torso, Lipos 360 and BBL, I mean, of FlexCalp 360 and BBL, that would be about 2.5 hours, and it's all done from start to finish. So we give people some light sedation by the mouth, so they would just feel not nervous, the anxiety, to take care of anxiety, and nothing more than that. But during procedure, you can get up if you want to go to the bathroom. No problem. We can arrange that. You are not out. So you talking to your doctor during procedure. We asking what kind of choice of music do you want to have in the room during procedure. It's not a problem, because you're actually communicating with the doctor from start to finish. So it's relatively easy. I think it's more pressure on the doctors than on the patient, honestly.
We'd love to hear that. I guess to people who aren't knowledgeable about like the whole cosmetic world, what are 5 fun facts you would give to someone who is, you know, looking for that insight or looking to get work done, but they just don't know what to do or what they should prepare themselves for?
Oh, no. Basically, first of all, we need to start an examination. We have to talk to the patient, check the body, and start basic process explaining what the patient can have. We never lie to the patient, because that's really not a good idea. It's going to all come back to you, so it doesn't make sense even to lie to the patient. And we're just trying to give them realistic expectation. Again, everybody would have a different question. We just try to address one question at a time. The advice how to prepare for the procedure, really, we give them the pre-op instructions to all our patients. And preparation for local anesthesia FlexCalp is very easy. You basically just do whatever you normally do. You don't have to do any changes. You can eat normally. You don't need to, be fasting 12 hours before surgery, no problem. We actually even advise light breakfast on the day of the procedure to give body more energy. So it's not a problem whatsoever. So the people really don't change any lifestyle before the procedure whatsoever. So just come with a chaperone, they bring the patient. We even before the procedure might give you something. Sometimes they say, I didn't eat anything. We might give them something to eat before procedure. Again, we're not intubating anybody. We don't put a tube in his throat. You don't have any of this. So we're not worried about all this aspiration and vomiting. We don't have any of that. So the patient just walks on her own legs into the room. We don't deliver them to the operating room. So they lay down at the table. During procedure, I can say, can you turn on your left side and your right side? It's so easy. I don't need 5 people to turn the patients on the bed. So it's relatively, it's very straightforward. There is nothing really in there.
And to follow up to that question, I've seen a lot of women who get BBLs and they feel like, okay, they got their body now. There's not really a whole lot that they have to do afterwards, but there really is some post-op, like the massages, exercising. So can you give us a little bit of detail on that as to post-op?
Yeah,
and
I feel massages, especially massages, and it's a rather complex of the procedures that used after, we call it post-op care. And it's very, very important. I usually say the procedure itself is a 40% of the result and 60% you're going to get from post-op. Why are we saying that? Because it doesn't really matter under which anesthesia, which doctor, and where did you do the procedure. The body was damaged in a certain area, and that's what we want to do. We want to take the fat out. So once we're damaging that area, it produces a lot of healthy, I would say, healthy inflammation or edema or swelling in that area. So the area becomes swollen. And it's normal, absolutely. And any procedure, the area becomes swollen because you're just traumatizing it. So, but the key to that is in order to get good cosmetic improvement, you have to drain that body. You have to drain part of that liquid, not to let it accumulate. There are a lot of points to that liquid. First of all, it's inflammatory liquid, meaning it creates a little bit of redness. It creates a little bit of, I would say, heat in that area. It's pretty uncomfortable when it accumulates in a large amounts because it's now stretching the skin that is actually a little bit irritated after procedure. So comfort-wise, for a patient, it's very uncomfortable to have a lot of liquid in there. So they feel right away much better, even after the first drainage. Once you drain that liquid, they say, oh, finally, I feel much better. Just because, no medications, nothing. You just drain that liquid. Faja or compression garment is so important, again, to sustain those cosmetic results that we try to achieve during the flex scalp procedure. So the follow-up, and it's supposed to be around, I would say, 10 to 15 massages after that. It's not just massages. We utilize a lot of different machinery like carboxy treatments, ozone treatments, ultrasound, VeloShape. We have many modalities that we use. Anything good to drain that liquid and to try to heal that territory. Exactly for that. And it's very, very important. I advise, it's mandatory at goals. The massages are mandatory at our facilities.
All right, well, doctor, thank you so much for your time. We appreciate all the information that you
No
gave.
problem. Thank you guys for hosting me today. And I'm sure we're gonna see you soon. Are you in Atlanta, right?
Yes, and can you tell us
I bet we're gonna see you soon.
you have and how people can contact you if they're interested in getting some services from you?
Thank you so much. Thank you, ladies. Thank you. I appreciate it. And gentlemen,
Can you give
appreciate that.
can you give us like your website and how people can contact you?
With that?
And where to find you?
Where can we contact you if someone wants to get service?
Hashtag Ghost Plastic Surgery or ghostplasticsurgery.com.
All right.
You're welcome. Call us. We'll take care of the rest.
Well, thank you so much. You have a great rest of your day. Thank you for all
You too. Thank you. Have a great weekend. Thank you.
Thank you.
Bye-bye.
Bye-bye.